Welcome to today's episode of the podcast. I'm so glad you're all here and listening. I am really grateful today to have with us Lorraine Bockman, and I will just give a little bit of bio so that you all know all the wonderful things in which she has worked. Lorraine here works in Colorado and is a licensed clinical social worker and a licensed addictions counselor. She has been recognized also as a master addiction counselor with NAADAC. And Lorraine, help me. What does that stand for again? National
The National Association of
Association.
Addiction Counselors, basically.
Okay, great. So she also is part of the Association for Addiction Professionals and has worked in the mental health and addictions field for more than 30 years. She currently works in private practice in the Denver area, specializing in addictions and related issues. She has previous experience also working as a program director, manager, staff developer, and a clinician with a variety of public and private nonprofit agencies in the Denver area, and has additional specialized training as a telemental health therapist, interventionist, expert witness, and a substance abuse professional under the Department of Transportation guidelines. She is also past chairperson and board member of a variety of legislative efforts that have been made in Colorado. And she's a current member of Denver's Metro Interdisciplinary Committee, MDIC, and a professional member of the Colorado State Board of Social Work Examiners. I know Lorraine from having worked with her in the family law community on cases in which I've had the need to have some expertise in substance use. And so I am very grateful to have you with us today, Lorraine. Thanks for doing this.
Thanks. And just to be
So,
clear,
yeah.
I'm coming to you from my private practice, not from any other kind of related entity.
Yes, absolutely. Thank you for pointing that out and clarifying that. I always say the same thing too. So tell me sort of, what are your initial thoughts about this? I want to know how you got into this work, but you can start sort of wherever you feel comfortable in terms of sharing your perspective.
All right. Well, pretty much all the work that I have done has been substance use related. I did kind of take a detour perhaps in the 90s and do a little I started out working in with kids, and so I took a detour into uh the Department of Social Services system as it was then. It's all been for the most part primary substance use, and so I have a wide variety of background. I've done work in the hospital emergency rooms, and I've done DUI groups, and I've worked with kids in the DYS system, as it was back then. And,
Mhm.
a lot of that background comes into play. And then I started working with adults and, it kind of got into that sort of realm of addiction work. And I've been in private practice for quite a long time. And so I think, you and I met through doing substance use evaluations, right? Because you're working in the family courts. And so that's kind of how I got involved. I got interested in the forensic side of social work and addiction work,
Mm.
and have kind of done a lot of learning and exploring in terms of what that should look like for substance use professionals. And, there's not a lot of standardized kind of realm out there. There's not a lot of
Mm.
writing and all of that.
So I guess I want to understand that too, like the
Sure,
dynamic between self-reporting and something more thorough that's, a broader, what are the differences between those two things?
sure. So I would characterize them as clinical evaluations versus forensic evaluations.
Okay.
And, this characterization is kind of taken from the parenting time, the custody evaluations, to borrow the old term, process, which is a forensic, a clinical evaluation is one where they're really looking for treatment recommendations as a part of the process, right? So the process is really kind of interviewing the individual. Maybe they'll do some, testing. Maybe they'll do a drug test. But it's really mostly self-report, as you said. And the purpose of that type of evaluation is really to get clinical recommendations for treatment. The individual is saying, or someone is providing them outside motivation to say, uh, I need to do something here, right? And so the person goes to get this assessment, and then they have some treatment recommendations that they can choose to follow or not. A forensic evaluation is really an investigation, and it's looking to answer a question for the court or multiple questions for the court. In the case of family law, it's looking to answer the question about how is this person functioning and how is their functioning with the children being impacted. Um, and and so that investigation is bigger than just an interview with the individual who's being evaluated. Um, the it's important to look at all other sources of collateral information in a forensic investigation. So you're talking to, in a family law case, you're talking to the other party in the case. You're talking to
Mhm.
professionals who are involved. You're talking to um, it maybe you get some personal references. Maybe you're looking at records. So perhaps you look at medical records and legal records and previous treatment records, if there are any. And maybe you talk to a therapist or the doctor and all of those kinds of things.
You talk about the courage that it takes for people to
Hmm.
really address this. Maybe talk about that a little bit. I mean, what do you see? You've got so many different hats on. I do too, where you're seeing what people are going through. Obviously, people love their children. It's not like they're trying to choose what
Right.
this substance is over their children, but what makes you use word courageous? And I mean, how do you articulate how difficult this is? Because people say, "Why
Sure.
don't you just stop?"
Right. People do say that all the time. Right. So you're asking the question makes me think of two things. One is that there is still a lot of stigma and a lot of shame around addiction, right? And mental health in general, right? And so I think it's challenging for people to step up and say, I'm struggling with this, because who knows what kind of reaction they're going to get, right? And there are still a lot of people out there that will just say, well, why don't you just quit? And it's not like that, right? Which brings me to the other thought, which is, you know, according to the American Society of Addiction Medicine, uh, addiction is a chronic brain disease, right? It's
Mm.
just like any other chronic disease, right? So you talk about diabetes in the same breath that you talk about addiction, right? And and again, there is at times disagreement in the field about whether that's true or not. Um, but that's what the physicians have said, is that, and they are doing the research to show that, right? That there's clearly more research, regularly coming out about how substance use impacts your brain. And so I think for the crowd that says, well, why don't you just stop? Uh, to say, look, this is a chronic brain disease. This is, the folks who with diabetes who are not medication regulated, right? Those folks too. Why don't you just stop? Well, it's not that simple. It's just not that black and white.
So what then makes you use the type of language like that it takes courage?
Well, again, stepping back into the therapy process, right? I want people to understand that I get taking that first step or walking into the office is hard. It's, like, I don't know what you've gone through on the other end, but you didn't get here overnight. And, and so I, I get that. I understand that this is a challenging process for you to even take a step into the room, and is challenging, right? Much less to take a
Yeah.
step into the room and say, I am struggling with my alcohol use and I don't know what to do next.
Just tell me, like, why you're
Sure.
doing what you're doing and your hope for people who or the hope you wanna give people.
Well, the hope is for a better life, right? I mean, the hope is for that they're able to um, get new skills, or they're able to achieve sobriety and maintain sobriety, or that they're able to reduce their use enough to rebuild a relationship, or, I mean, it's the hope piece, right? Like it's the okay, how is my life going to improve? Maybe I'm not going to stop, right? But maybe I can do some things that will make a difference in the relationships in my life. And that is enough right now, right? So I think that's why I keep doing what I'm doing.